Did you miss your deadline to renew your Medicaid coverage? You can still send your completed annual review form to Healthy Connections Medicaid. You may be assigned to another health plan, but you can ask to come back to First Choice within 60 days of renewed Medicaid eligibility. It's your family. It's your choice. First Choice is the right choice. Renew and choose us. Visit selecthealthofsc.com/renew to learn more.
You're listening to a CNA podcast. Welcome to the Climate Conversations. I'm your host, Julie Yu. Today, we are diving into something that's been top of mind for many people recently, and literally in our faces, the haze. About 2 weeks ago, Singapore's air quality fell to the unhealthy range for the first time since 2019. The culprit: smoke from forest fires in Indonesia. Southeast Asia's transboundary haze has been a recurring problem for years, with particularly severe episodes costing affected countries billions of dollars and having a negative impact on human health. We're joined by Adjunct Assistant Professor Joel Ake from Duke-NUS, who led a study looking into how air pollution can cause serious illnesses. Now, do remember to like and subscribe to this podcast so you know when the new episode drops. Leave us a message on Spotify or Apple Podcast to let us know what you think. Professor Ake, great to have you on the Climate Conversations.
Julie, thank you for inviting me onto your show.
Firstly, can you share with us what your study found in the link between smoke-related pollution and our health?
So in Singapore, research on the effects of air pollution and health have been a little less research compared to other settings worldwide. But I think in recent years, Singapore has picked up on that research gap, and we've produced more evidence on the effects of air pollution. One of the things that I looked at was looking at how PM 2.5 increases the risk of cardiac arrest. And we found that just within a matter of days, I think within 2 days, being exposed to an elevated level of PM 2.5, that already increases the risk of cardiac arrest. I looked at just a couple of years ago the effect of air pollution on acute conjunctivitis. So that's just your red eye, kids get it, you get it, I get it. And we found that elevated levels of particulate matter were associated with a higher number of reports of acute conjunctivitis in polyclinics. There's also been other research. For example, we also found some of the effects of air pollution on pediatric health. So associations between nitrogen dioxide and sulfur dioxide, increasing the risk of respiratory diseases among children below the age of 5. So that research has given us more evidence to review our policies. And with the haze, it's not something that comes overnight. There's a kind of a lead up to it. We've seen that occur in 2010, 2013, 2015, and 2019. We've got satellite images looking at the number of hotspots in the region. So I think our government and the hospitals, they're well aware of this and they're well prepared if there's an increase in emergency admissions.
Absolutely. And you've also evaluated interventions. So Professor, what is haze? Just how dangerous are they?
Okay. So what is haze? I think different people have different definitions. But basically, haze is really a suspension of dust, smoke in the atmosphere that leads to a reduction in our visibility and the clarity of the sky.
But what are the main pollutants in the haze that are harmful to our health? And how do they differ from, let's say, cigarette smoke?
One of the key components of smoke is actually this thing called particulate matter of diameter less than 2.5 microns.
That's tiny.
Or you can call it PM 2.5 in short. Now, how small is PM 2.5? So if you think most of us have, at least some hair, but think about that sort of width, and it's like 25 to 30 times smaller than that.
Oh my.
That's how small PM 2.5 is. It can easily get into your airways, into the deepest recesses of your lungs, and get trapped there. They can cause inflammation, they can cause infection, They can even get into your bloodstream where it can build up over time, together with all the unhealthy cholesterol that Southeast Asians are really used to.
I see.
And that could easily lead to increased risk of adverse cardiovascular health events.
A few minutes of haze exposure, can this lead to serious health issues?
So the World Health Organization, they are the authority in setting what the acceptable air pollutants levels ought to be. They reviewed these standards, I think, most recently in 2021. So these threshold levels are the minimum levels which they did not find any adverse effects. So for example, for PM 2.5, the 24-hour acceptable threshold is about 15 micrograms per cubic meter. So we don't have that sort of evidence that allows us to determine whether a few minutes of exposure might lead to adverse conditions, but there is good evidence, and I would say strong evidence, that 24-hour exposure above the acceptable level has been associated with an increased risk of various types of diseases.
So who are the most vulnerable individuals?
I think there are two particular groups that are vulnerable. One is obviously children, because at that very young age, their lungs are still being developed all the way up to 6 years of age. The other group, clearly the elderly. So those above 65 years of age, they're probably at increased risk of adverse health conditions. If you've got pre-existing heart condition, you would want to try to avoid high levels of particulate matter exposure so that you don't have a further increased risk of having an adverse health event.
So what are some of the general symptoms the haze can cause for members of the public, and what are the long-term harms to our health?
In terms of the symptoms, it's quite obvious. You might have a dry throat, you might experience coughing, maybe some difficulty in breathing, but it also depends on each individual. So for example, a couple of years ago, I was at a scientific conference in a country in Asia that is particularly known for its high air pollution levels. The air quality levels were so bad that even their local air quality index couldn't register air pollution levels higher than that. But I wasn't coughing.
Must have been pretty bad.
Yeah, it was pretty bad. But I wasn't coughing at all. I was fine. And we were there for 3 days. So I really think it depends on the individual health conditions to know whether you might be adversely affected from the air that we inhale.
In terms of air quality, there are different ways of measurements, right? Such as PSI. You also mentioned 1 hour PM 2.5, and there's something called air quality indexes, so on. Which rating should we focus on?
There are different types of indices, and I think it really depends on the health authority in that particular setting. In Singapore, we primarily rely on the PSI for most members of the public to understand. They just look at a single figure, right?
Yeah.
Is it in the healthy range? Is it in the moderate range? And so on and so forth. But for those of us who are more curious and we can appreciate finer details, we know that the PSI values are made up of individual values from other types of air pollutants. So we've got PM 2.5, PM10, sulfur dioxide, nitrogen dioxide, ozone, and carbon monoxide. So 6 pollutants. And within that hour, the pollutant that is at its highest value will contribute to the value of the PSI.
Hello, my name is Steve Lai,
And I'm Teresa Tang, and we are the hosts of CNA Correspondent.
a podcast that takes you to the heart of the work our correspondents do across the globe.
From China's COVID response to the childcare center massacre in Thailand.
And from the fall of Najib Razak to the rise of Anwar Ibrahim as Malaysia's Prime Minister.
We speak to the people at the reporting front lines.
So if you want to know how the biggest global stories unfold, make sure you follow or subscribe to us wherever you get your podcasts.
So at what PSI level should we be concerned, and when is it advisable to wear an N95 mask?
So basically, there are 6 bands for 24 PSI hour reading. If the PSI is within 0 to 50 or even 51 to 100, you can carry out normal activities. But when it goes into the unhealthy range, 100 and above, then we would need to think about whether you should engage in strenuous activity or you try to reduce it or even avoid it depending on whether you're a healthy person, an elderly person, or someone with pre-existing conditions like lung disease or heart disease, you should avoid strenuous activity altogether.
Speaking of activities, I mean, we do see some people exercising outdoors even during the haze period. I mean, that's not a good idea, is it?
I think it depends on how healthy they are and what kind of strenuous activities they're engaging in. Physical activity has its benefits for health, so you have to weigh the risk versus the benefits. If they don't encounter any adverse symptoms, I think they could possibly continue. It's in a healthy range, but what I would say, and I personally observe, is that there's an increase in cycling. We see more cyclists in park connectors. We see more cyclists on the road.
Right.
But the best time to cycle on the road is not during the busy traffic hours. So apart from haze, which is produced from land fires, PM 2.5 is also produced from combustion motor vehicles. And this occurs even outside of haze periods. So if you're a cyclist, you're an avid cyclist, you like to cycle to work often, you might want to think about doing that when the traffic is less intense to reduce your PM 2.5 exposure.
That's a great tip. And not only physically, you've also evaluated interventions and programs to inform public health policy and practice. I wonder what sort of specific measures can we take to protect ourselves from the health risks associated with haze?
The easiest thing to do is to wear a mask, and not just any mask. The masks that we use for COVID-19, they're not going to be very helpful in reducing the exposure to PM 2.5. We would need to wear something like an N95 mask that's meant to screen out the large majority of particulate matter. And the government has already assured all of us there is enough. There's no need to go to NTUC right after listening to this podcast. So have those ready and use it when the advisory suggests that we do so. The second thing is really to look at the health advisory that NEA has put out. That's going to be really useful in reducing your risk of adverse health conditions. So depending on which group you belong to, look at what the PSI level is in the last 24 hours and then adjust your activities accordingly. But staying at home and closing all your windows without doing anything may not be such a good idea. People often think, well, if I'm indoors, I'm less exposed. Yes and no. We have to think, well, where does the air in the indoors come from? And they all come from the outdoors.
True.
So if you're closing up all your windows, you might be able to prevent new PM 2.5 from coming into your home, but you're limiting the amount of airflow, so you're not actually removing PM 2.5. Well, actually, you might be, because if there are a lot of people in your home, you might be inhaling the PM 2.5 and cleaning the air that way. But obviously, that's not a great way. So if you think about where the air comes from and the need for circulation, I know that some residents here in Singapore are thinking about investing in some technology. So if there are these air cleaning or air filtration devices that you can buy and put in your home, when you buy air cleaning devices, they are specified for a certain space. So if you're buying a tiny one, don't expect it to clean your whole house really well. It might work for maybe your bedroom, but that means that you would have to seal the doors for it to work effectively. Also, make sure that the filter within those devices, they are swapped out when they are spent.
Wow, so plenty of weight.
I also am aware that some air conditioning units, you can fit special filters in them, and they can clean out some of the PM 2.5 particulates in the air. So then you kind of know whether you're in a safer sort of environment or otherwise.
All right. So before we let you go, Professor, what are the lessons we can draw from the previous haze crises, and how can the country better adapt and prepare for the haze season?
So haze isn't a new issue. We've been through it before. At least in the last decade, there have been at least 4 years that we've experienced haze. We've always come out on top. I think there's no need to panic. And what we need to do is to just be responsible for our own health, be more aware of what the air quality is like, look at the health advisory. Some of us, we have a young mindset, and while we may be middle age or older, we think we're still young, but not all of us are. So we should watch over our health.
The brutal truth.
And I think most importantly, if you encounter any respiratory distress, you should stop your physical activities and consult a doctor and get early intervention.
Wow, it's certainly been an eye-opening conversation. Professor, thank you very much for joining me today. I appreciate your time.
Thank you, Julie.
Well, thanks to my guests and thanks to everyone for tuning in. I hope you enjoyed this episode. Now, do remember to like and subscribe to this podcast so you know when the new episode drops. Leave us a message on Spotify or Apple Podcast to let us know what you think. The team behind this podcast is Sign Win, Jacqueline Chen, Joanne Chen, Tiffany Yang, Crispina Robert, and I'm Julie Yu, signing off.